Okay, good to go. Hello, good morning. Welcome to Rupani Foundation USA. And thank you so much for having me again. I'm very delighted to be here today. My name is Dilshat Meghani, and I'll be your moderator for today's webinar on the benefits of doula support on behalf of Rupani Foundation USA. I am pleased to invite guest speaker Mrs. Rachel Stonebrook to discuss all about the benefits of doula support. RFUSA believes that pregnancy and the postpartum period bring about great change to the physical and emotional well-being of a woman, with nutrition, in particular, having an impact on the health of the baby. Today, our guest speaker, Mrs. Rachel Stonebrook, is going to further discuss following topics. Number one is doulas aid educates. Number two, support throughout pregnancy and delivery. And number three is postpartum support. Okay, let's go to the agenda. We have a full agenda today. We have a lot of attendees still logging in, and again, thank you everyone for joining. We will be keeping a close eye on the Q&A box for questions and comments. I'll try my best to ask all of your questions. You can send us email as well. So let's get to it. We will also assist you with some webinar guidelines to participate in session. We will share with you all a brief introduction of our panelist and guest speaker, Mrs. Stonebrook, will then share her presentation with all of us. We are very excited to hear who she is and explain more in depth about the importance of doulas during and after pregnancy. We will also be asking some quick poll questions throughout Mrs. Stonebrook's presentation. I request all to please participate and share your responses with us. Again, we encourage you to use the Q&A box for the questions you would like to ask, and we'll do our best to get to all of your questions at the end of the presentations. Let's go to the webinar etiquettes to follow. Attendees will be muted to ensure clarity for the speaker and panelist. In the 60 minutes of this webinar, we have scheduled time at the end for the Q&A. Please use the Q&A chat box at the bottom of your screen. We will do our best to ensure your questions are answered. Today's webinar is being recorded and will be available on Rupani Foundation social media platforms for later viewing. We will be also asking you all to take a brief survey at the conclusion of the webinar. Please take a moment to fill this survey out. This will be better assess the needs of our attendees for future webinars. I'm glad to have our panelists and our guest speaker with us today. My warmest welcome to our guest speaker, Rachel Stonebrook, our founding chairman, Mr. Nasruddin Rupani, and our CEO, Mr. Amit Motwani, for being with us. Before I'm going to turn it over to the speaker, I would like for you all to answer a quick poll question that's going to be pop up on your screen. So you can see the question on your screen. So let me read the question for you. It says, why would I need a doula for my firstborn? So you have options that help for partner, additional support, or all of the above. So I'm going to give you a moment to click on your responses. I can see your participation. Thank you so much for participating in my first poll. Thank you. So now you can see the result I'm going to share on your screen. Okay, according to this poll, we have 33% Participants have chosen additional support, and 67% of the attendees are agreed with all of the above. Thank you so much for participating in the poll. Thank you. Now, I would like to introduce today's guest speaker, Rachel Stonebrook, further. Rachel Stonebrook is a business owner, doula, partner, and a parent to 3 girls, 2 bearded dragons, 1 dog, and 1 hamster named Mr. Nibbles. She earned a BA in English Literature from Audubon University and MA in Women's Gender and Sexuality Studies from the Ohio State University. She has been consulting and instructing classes, workshops, trainings, and lectures on topics related to diversity, cultural competence, gender equality, communication, women's health, and wellness for over 14 years. With this, I will now turn it over to the speaker, Mrs. Rachel Stonebrook. Please.
Thank you, Dilshed, and also the Rupani Foundation. As I share my screen, I thank you for putting together this webinar series. I think it'll help hopefully a lot of community members and families think a little bit more about health and well-being and nutrition and support during pregnancy. So my presentation today is on the benefits of doula support for women and families, like Dilshed mentioned. And I'm going to walk through a couple different presentations. There's 3 of them today. Each of them are between 10 and 15 slides, and we'll just walk through both some, first of all, what is a doula? What are the benefits of a doula? The second one is a little bit about support during physical and emotional support during labor and prenatal. And then the third talks a little bit more in depth about what that support looks like when it comes to postpartum and advocacy and other areas of families' lives. So first and foremost, she introduced me, which is fantastic. That's true. I have a hamster named Mr. Nibbles, and I have 3 children and a couple of animals at home and a husband. And I think those are important things to mention whenever we're talking about, birth work and families, along with the work I do for my clients in the community. I also have 3 children and run a home and homeschool and all that kind of good stuff. And I love doing, teaching workshops and trainings on these topics that are near and dear to my heart. So thank you. I'm glad to be here with you today.
You're welcome.
So the first thing I want to mention is I want you to consider, I'm going to kind of map out a picture for you today to think about. And as I'm describing this story, I want you to think about the things that I mentioned that maybe you don't know anything about, or things that you might want to know more about. But it's a typical story of a lot of women that go into labor. It's 2 a.m. and you've been laboring at home for about 12 hours. You decide to go to the hospital thinking it's been too long that you've been in labor, maybe, you're not sure. But you think it's a good idea to go to the hospital and get assessed, right? Your contractions have been coming between 7 and 10 minutes apart. They're about 35 to 40 seconds long. They feel really strong to you. But when you arrive at the hospital, they check you into triage and they ask your husband to step out. Well, they ask you some questions and assess you for admission. You weren't really prepared to be separated from your support person, but nevertheless, you're eager to find out what's going on. The triage nurse announces after doing a cervical exam that your cervix is only dilated to 4 centimeters and 60% effaced, and that your baby is high in the pelvis. The triage nurse also tells you that you're not quite in active labor yet, and you can still go home if you want and continue to labor, or they can admit you from observation and augment your labor. Unfortunately, your doctor, who you've worked with for 9 months, is not on call tonight, but there's a hospitalist on staff who will be in shortly to discuss these options with you. At this point, you start to notice your contractions have begun to kind of fizzle out a little bit. They've spread apart. And the recommendation when the hospitalist comes in to discuss your options, the recommendations is to go ahead and break your water and augment your labor with Pitocin. It wasn't quite the way that your birth plan or your birth vision was going to go, but this is where you're at. It feels very overwhelming. You're wondering, should I go home or should I stay and use medical tools to progress labor? Have they explained all my options to me? Or maybe I still have questions that I should ask, but I'm not sure how to ask. In this moment, what if you could have an expert by your side, someone with non-judgmental support and advocacy, someone who could bridge miscommunication and improve that uncertainty that you feel, someone who might have lots of experience with childbirth and provide evidence-based information to help you and your partner and your family make informed decisions. Someone who can also use comfort techniques with you until you're maybe ready to get medical pain management. What benefits would this offer to your experience and labor outcomes? Well, that's what a doula does, and that's what I do. And so a doula is a person who is trained and experienced in childbirth and provides continuous physical, emotional, and informational support to women during labor, birth, and the immediately postpartum period. Defined by DONA, which is the Doulas of North America group, women choose to labor and give birth with doula support for a wide range of needs, goals, and concerns about their childbirth experience. Many women want to be encouraged and supported as they give birth, in many cases without pain medication, while other women desire a liaison between themselves and the medical staff. Some women have no family to support them, while others, really have a lot of family who are kind of all have opinions and thoughts about the way somebody should labor. Just a quick, history. In 1930, around that time, there was a growing a movement towards, having birth in the medical hospitals, or more medical professions, basically caused a shift in childbirth. And so we went to more medical illness model of birth. Traditional midwives often, who had been trained either by apprenticeship, were kind of, went away with the times. And childbirth became a means of demonstrating kind of new fancy technology, medicine. More women began birthing in hospitals with the aid of primarily male physicians. And the shift was clearly a great benefit to high-risk women, but low-risk women were subjected to a battery of interventions that often were counterproductive to healthy labor and delivery. And then in the 20s, the forceps, use of forceps was, promoted. Anesthesia became widely used during the 1940s. And then by the 50s, including my mother, in the 50s, 60s, and 70s, they would use something called twilight sleep, where you would just be put to sleep while giving, not even conscious while giving birth. And in the 60s and the 70s, epidurals and continuous electronic fetal monitoring was implemented as policy. So the need for doula support has, come up as at one point a trend and now as a necessity for many families, because some of the childbirth interventions are at an all-time high. We're still seeing the national cesarean rate over 31%. And the rate of induction of labor in the US has risen from 9-10% to over 25%. And this is as of 2018. Of that, 31% of first-time births are induced. And definitely this is also a big number. The rate of epidural use in the United States is 71%, with Texas being 77.5% of people using epidurals in hospitals. And the majority of women do labor in a bed and birth on their back in the lithotomy position. So overall, it makes a lot of sense why we would have some concerns about how women are laboring and what those outcomes look like, specifically when the most recent US maternal mortality rate is almost 20% per 100,000 pregnancies, and that more than half of recorded maternal deaths occur with Black women being 37.1% of that, which is 2.5 times as much as white women for 14.7%, and 3 times the ratio for Hispanic women, which is 11.8%. And so it's important to recognize that we're talking more, the bigger picture here is really looking at not just getting comfort strategies in labor, but also advocacy, right, is a big piece, and decision-making. Some major tenets of what a doula does is we recognize, birth as this key experience that we'll remember, right? You'll remember all your life. We perceive our role as being one of caring, nurturing, protecting that experience for you. We also, do that by staying with you throughout labor. And we also, many of us understand acutely the physiology of birth and the emotional needs that come up during labor, especially during emotional plateaus and times when you are, struggling with pain. And so, in that vein, we help you prepare, labor plans, birth plans during your prenatal period. We try to facilitate communication between you and your partner and your critical care providers during pregnancy and far into during labor. And also we work with partners. People sometimes think that doulas are interlopers, or somehow that excludes your partner from being a part of, or, working with you to make this, participating with you as a team. And in fact, one of the things that we do is work acutely with partners. So they have some kind of, they feel productive, they feel useful, they feel needed. And also we specifically find ways to provide emotional and physical support, comfort measures with an objective viewpoint, and getting you information to make an informed decision. Sometimes, when you, I will say this, like if you, as doulas, there are a lot of things that make us very similar to one another in terms of our practice and where we support families. However, there are a lot of differences between us in terms of experiences and training. And so we have a wide variety of skills and extensive experience supporting a number of different kinds of birth experiences in people. These are all the ones that I'm very comfortable supporting and that I have skill and extensive experience with, but not all doulas do. And so those look like, the hospital births, home births, birth center births, and some people want water births. High risk is different than low risk. Those are families and women that have different needs and different providers and may need a different level of support. Some folks, choose to go the route of adoption or surrogacy. Some, not all outcomes end in a baby in your arms. There are many outcomes where women have a miscarriage or, have a fetal demise. And so those are also roles that doulas take up. And in many cases, sometimes it's important to use the tools that are available and to have a medicated birth or an unmedicated birth. And sometimes we do need a surgical birth. A lot of times doulas get hired to avoid cesarean sections. And we can talk a little bit about what that looks like in our advocacy piece. We also have to be mindful of sexual assault survivors. That plays a huge part in how women cope during childbirth and how they feel safe and trusting of their birth team and their space. And I also support LGBTQIA families. Families come in all shapes, sizes, walks, cultures, ethnicities, and race. And it's important that we approach people from where they're at, and we meet them where they're at, and we know how to support all different kinds of families. In addition to that, a lot of us have extra skill sets in doula support, like lactation, breastfeeding, chest feeding, placenta prep, belly binding, the list can go on. So what does the research show specifically about the benefits of labor support? There were, continuous support was, for example, one of the studies showed that continuous support was provided either by a member of the hospital staff, such as a midwife or a nurse. There were 9 studies that looked at that. and that women who were not part of the birthing person's social network and not part of the hospital staff, so we're talking about doulas, there was 8 studies done on that, and childbirth educators. There was 1 study done on a retired nurse. Anyway, there's a plethora of studies looking at support people with the birthing person. And what they found was that overall, people who received continuous support were more likely to have spontaneous vaginal births and less likely to have any pain medication, epidurals, negative feelings about childbirth, vacuum, or forceps assisted births, and cesareans. In addition, they found that labors were shorter by 40 minutes and their babies were less likely to have a low APGAR score. And there is a small amount of evidence out there that suggests that doula support in labor can also lower postpartum depression in mothers. And so it's important to kind of acknowledge that, the fact they're doing studies on this and they're finding substantially great benefits from having a non-judgmental support person that is outside your social network, who can help support you through labor and delivery, prenatally, labor, delivery, and postpartum. What are some of the benefits? The researcher also looked at to see if the type of support made a difference. They wanted to know, does it matter who the birthing person chose for continuous support? On Evidence-Based Birth's website, she goes down and lists a number of benefits in her comparison of these studies. And she looked at the outcomes of like pain medication, use of Pitocin, spontaneous vaginal birth. And so she found that there was a 25% decrease in the risk of cesarean, especially with doula support. It went up to 39%. Another fact that she discovered in comparing these studies was that there was a 8% increase in the likelihood of a spontaneous vaginal birth, up to 15 with the doula. Some other ones that I think are important to mention is everybody likes a shorter labor. So definitely, the shorter labors by 41 minutes. I can't guarantee that, but definitely I can see over time in my work that labors are a little shorter because women and families are more prepared. They know what to expect. And so we work together to help them get through labor. And the biggest one here for me as a doula is the 31% decrease in the risk of being dissatisfied with a birth experience. A birth experience stays with a woman for her entire life. And so to know that we can give continuous support and that's going to improve that memory for her and that experience and help her be a better mother, be a better person, be whole is an important goal for doulas. Compared to family members and friends, and those are great support people and they have their own role and their own skills, doulas were often more effective in decreasing cesarean and pain relief rates. A lot of the clients that I have come to me for, looking to have natural labors. And so looking at, how we can reduce those intervention rates are really important. Doulas also positively affect breastfeeding rates. Just some stats on that as well from Evidence-Based Birth. And she shared that breastfeeding at 6 weeks with a doula has improved breastfeeding rates of 29% versus 51% with doula support, 29% success rate without. And that feeding issues with doula support increased by 63%. So, which is really great. It's a substantial number and a compelling reason to look at birth work as positive support. So how does a doula fit into all of this, right? You have providers, you might have a midwife, you might have a nurse, you have a husband or a spouse or a partner or a wife. And so looking at, the research shows that parents who receive support during birth, when we work as a team, feel more secure and cared for, are more successful in adapting to new dynamics, have greater self-confidence, have less postpartum depression, and have a lower incidence of abuse. And so these are kind of, I think, really important other reasons too. And lastly, but not least, looking at this conceptual model kind of shows you the way that the cause and effect of doula support, continuous labor support can really have on not just women's experiences, but also the progress of labor, the way that having labor support can increase oxytocin, can increase mobility during labor, can increase self-esteem, can decrease pain, can decrease anxiety, that all of this kind of interacts with each other. When we have increased oxytocin, we have a decreased need of medical pain management. When we have decreased use of interventions, we have a higher satisfaction rate and a higher chance of spontaneous birth. What is not included in doula support? We are not medical professionals. We don't perform vaginal exams. We do not track baby's heartbeat. We might bring a Doppler to our visits to educate and show you how a Doppler is used and to listen to your baby's heart rate, but we do not diagnose. We don't make decisions for you. We definitely are collaborative in our decision-making. We'll give you our opinion. We'll tell you our experience. We'll show you evidence-based information, but we don't speak on your behalf. We don't pressure you to make certain choices. I don't have a preference whether you get an epidural or not. What my choices are separate from what your choices are. We meet you where you're at. We do not take over the role of your partner or your family members. They have just as much of an important role in your well-being and your family planning. We don't catch babies. On occasion, sometimes there's a fast birth and we find ways to get emergency help for the family, but we don't catch babies and we don't prefer to catch babies. And not a lot of us change shifts. We like to stay with you through your whole labor if we can. I work with partners. If I need to, I get a backup. Or if I'm at another birth, it's nice to have partners who will help support my clients if I can't be there for them. So now I'm going to pull up the second slide.
Excuse me. Okay, let me pull up the poll. Yep. Then we will go for the second slide.
Okay, perfect.
Okay, thank you so much. And it seems like you are also an animal lover like me. I love dogs, and you have a cute dog. Okay, and thank you for sharing your expertise and a brief discussion about what's doula, and especially you are making my understanding about the doula. Even I don't know that much clear about the doula support and everything like that. Thank you. Again, if you all have any questions, you may ask them at any point during the presentation in the Q&A box, and they will be answered at the end of this session during Q&A portion. So after learning so much about the doula is educates, I'm going to take you to my second poll question. So you can see the poll question on your screen. So the question is about what benefits does the presence of a continuous support persons have on a woman in labor? So you have three options: shorten duration of labor. The second option is decrease cesarean birth. And the third one is mind and body comfort. So I'm going to give you a moment to click on your responses. I can see your responses. Great. So let me share the result with you now. So you can see the result on your screen. So according to this, 100% of the participants are saying that mind and body comfort. Thank you for your participation. Okay, perfect. Now to discuss support throughout pregnancy and delivery, I will once again let the speaker take over. Mrs. Stonebrook, please.
Thank you. I'm going to go ahead and pull that one up.
Yes, I can.
I'm trying to figure out which one it is. There it is. Okay, got it. Okay, wonderful. So the second part of this is talking a little bit about education and preparation, which is a huge part of the work we do. There are doulas that will show up to your birth without any preparation or any meeting. Most of us, though, we like to make sure that you guys feel, our clients at least feel very informed and ready to, handle what might come up and have some sense of what to expect. So education and preparation, informational support is really important, specifically during the prenatal period. It's really important that we prepare you for what to expect, but also it's important during labor as well. Keeps you and your partner informed about what's going on with the course of labor. How do you know if you're in early labor, or how do you know if you're in active labor? And also what your birth options are. Some aspects of informational support include guiding you and your partner through labor, suggesting techniques for labor. Some of the things that we will talk about here in a minute are breathing, relaxation techniques, movement positioning, offering up evidence-based information about different options that you might have, helping to explain medical procedures, right? As most people are not familiar with a lot of the medical procedures in birth. In pregnancy and childbirth. We discuss, prenatal testing. We discuss nutrition. We talk about, and then also help your partner know what's going on during labor. Sometimes partners have a hard time seeing their loved ones in pain. And so what we do is normalize that experience for both the laboring person and the partner, especially when there's lots of noises and things happening that we're not familiar with. So a support timeline, just to kind of give you a snapshot of what the work would look like, what kind of support, or I should say educational support would look like from the beginning of meeting a prospective doula until you are complete in your relationship and your needs with her. So the support timeline starts with a consult. I have people inquire all the time, email, phone, they'll call me, they'll find me during my website, they'll come to me based on referrals, especially if I have a good history, which I do. So our initial meeting is a consult, and we basically get to know each other a little bit. We discuss what kind of support you're looking for and if we're a good fit together. It's such an intimate experience to have a baby, and to go through all of this with a couple is really important, or with a single. It's very important to have a good vibe and a good energy together, right? Because I'm one of those folks you're going to need to trust in that process. Once you decide to hire a doula that you have chosen, we schedule visits. So I like to see my clients in particular, most do, at least 2 to 3 times over their pregnancy. I check in a lot with my clients throughout their pregnancy via phone and email. If they want extra visits, we'll do that. But the 3 to 5 prenatal visits, or I should say 2 to 5 for some people. Some doulas only do 2 visits. I do 3 to 5, so that's why it's in here. Look at, really deep diving on issues around birth planning and education and labor prep and postpartum planning. So we do a lot of educational work and resources, referrals, communication building. Number 3 on this is the ongoing support 24/7. So from the moment you hire your doula, you'll have access to her. Ongoing support 24/7 means, you can text, you can call, business hour calls, depending on the doula, but you can text and email and call and reach out about questions, concerns. Maybe you've seen your doctor and you have questions afterward that weren't answered, to your satisfaction. Maybe you need to reframe questions. That's what we're here for. We're here for all of that support ongoing. In addition to that, emotional, physical, and education support during your labor, suggestions for labor progress. We do lots of labor coaching, meditation coaching, breath coaching. We show up for your labor when you call us. We stay usually up until a few hours after birth. We employ lots of different kinds of modalities around changing positions and vocalization and acupressure and aromatherapy, and at your choice, of course, of where and how your preferences are, that we worked on during your pregnancy. And so we also help you with best evidence-based information, so you feel completely informed about all your options. Then we do, usually after birth, if you choose to do any kind of feeding, whether that's lactation or it's bottle feeding, formula feeding, we stay and help with first latch or with how to do paced bottle feeding. We work a lot as lactation consultants. It comes with the job. So And then finally, we follow up with a postpartum visit. So that looks like, we tend to come to your home within a week or two after having a birth, sometimes 2 visits within 6 weeks after giving birth. And we're there to help with, again, breastfeeding support, referrals, processing your birth, finding areas that you may need extra support in, making sure that you feel that you have all the options that you need at your fingertips. And we'll talk a little bit more about postpartum in a minute. So what does prenatal education look like? It can be it can take many forms during your pregnancy. It can look like discussing, and that's kind of the nice thing about having a doula, because it can be different. You can customize it with your doula based on your preferences. So sometimes we discuss anatomy and physiology of pregnancy. We talk about, maybe sometimes we have to work through and talk about a pain management plan. Sometimes my clients are really interested in going unmedicated. And so we work through that and create a plan for, comfort strategies. Lots of times new first-time parents are looking at, how do I know I'm in labor, right? So helping clients learn what the signs and symptoms are, how to track contractions. We give suggestions for partner support, birth planning, activity and diet, and some relaxation and breathing techniques. Those are all big forms of education during your prenatal appointments. Just a couple of examples about what that looks like. So in prenatal nutrition and wellness, many of us have had trainings or background on some basic nutritional, advice and suggestions for wellness. Of course, a lot of that looks like, encouraging women to eat fresh fruit and healthy fats and raw steamed veggies and lean proteins and things like that. But sometimes it also includes talking about, for example, about low iron in pregnancy and ways you can improve your iron, or maybe the best prenatal vitamins out there, or a prenatal vitamin that you can take while you're feeling nauseous. Sometimes we give advice on heartburn medication and things that you can do holistically to take care of the discomforts. In addition to that, we discuss, prenatal nutrition comes up actually before you take your glucose test at 28 weeks. And again, before you take your GBS test at 38 weeks. Those are both tests that they do routinely. And there's some things you can do nutritionally, preventative wise, to make those tests have an optimal outcome. In addition, the other example of what prenatal education looks like is local resources, referrals, provider recommendations, and birth place options. Experienced doulas usually have a network of providers they can recommend. So a lot of the education piece can start at the very beginning with clients seeking doctor or midwife recommendations, people we've worked with a lot, we know well. Sometimes we have clients that are looking to maybe have a birth center birth, and we've worked at many, so we know which ones might be a good fit for them. In addition, especially during the last year, we can help transfer clients to a better provider, a provider that will allow them to have their family members present, providers that, that align more with their birth goals, and also suggestions for best hospitals. In addition to that, we work with a lot of different, other providers such as chiropractors, acupuncturists, pelvic floor therapists, licensed massage therapists, lots of different folks that we feel really good about referring that will help you have, optimal wellness during your pregnancy and postpartum. What does a birth plan look like? Well, a lot of birth planning starts early. We talk a lot about that it's a communication tool, an education tool that starts with you and your doula and your partner, and if you have a partner. And in many cases, it helps us, it's an education tool because it helps us categorize and understand what your birth preferences are. Do you want to wear your own gown? Are you a modest person? Would you prefer not to have students and residents in the delivery room? How do you feel about erythromycin during newborn care? It's really a great opportunity to talk to your, it's a great opportunity that creates questions for you to ask your provider specifically. For example, How would you respond if I preferred to push in other positions outside of my back, other than my back? Or questions about delayed cord clamping. You can ask your provider, how long do you usually wait to clamp the cord? So birth planning really promotes more questions and more information between you and your provider. And it's an opportunity to also discuss with your doula what happens if your birth doesn't go as planned. And we need a surgical birth. What does that look like? Do I have options there? Or what about newborn care? What happens during the newborn exam? What should I expect? So it's also a great time to discuss a postpartum plan with your doula and to have something in place for how will you take care of yourself and a new baby after they arrive. The other piece of education that comes on, a couple other things. One is the role of the support person. This is a checklist that I give out to a lot of my first-time dads that looks at what are the things that they are familiar with in terms of techniques. Anything they're interested in, we can go over during their prenatal visits. Doulas are great about sharing their best tips and tricks for comfort strategies. We want your partner to feel comfortable. We want them to feel efficient and useful. And we want it to improve your relationship because it's so important to have that closeness and feelings of teamwork at the end, especially of your pregnancy. And not to mention the increase of oxytocin levels, especially with romantic partners, does a ton for labor progress. So we really encourage that. Another thing we go over is what to bring and why. Essentials for pregnant women, what to pack if you're having a C-section, checklist for your labor partner, essentials to pack for your baby. What all do you need, really, right? So sometimes it's great to talk to a doula about different kinds of pro tips and things that she might suggest, depending on your scenario. You would pack something differently in your bag if you were having a birth at a birth center versus a hospital. You would pack differently if you're having a cesarean versus a planned cesarean versus a vaginal birth because you're going to be at the hospital longer. The other couple of things that we discuss prenatally, sometimes come up. So sometimes a discussion on intervention comes up during prenatal appointments, and it's prioritized because for many reasons. One could be this is a second or third time mom who feels that her first birth had too many interventions and she wants to avoid them. Or sometimes it's a first time, mom or a first time birther who feels that she wants to avoid interventions and she's not sure how. Which ones are important to avoid? Should I avoid all of them? Is it as scary as sometimes it seems to use Pitocin during labor? Will it make my contractions stronger? And sometimes we have to discuss interventions and it comes up around week 40, 41. If your doctor or your midwife is recommending an induction. And so we want to walk through what that looks like, what your options are, how you can advocate for yourself, and what to expect. And so, of course, sometimes these come up during labor as well. And so having a doula there to help you navigate some of those decisions so you can make the best one for yourself can go a long way to feeling calm and peaceful and confident during birth for sure. And finally, this comes up so often in prenatal education is medical pain management. We hear this all the time, pros and cons of medical pain management. What are the benefits? Should I avoid an epidural? My friends all had one and they said it was the best thing they ever had. And then I have clients who say, I don't want it. I don't want it for me. I'm worried about my baby. Will it pass the placenta? This is a great conversation to have with your doula. This is something I work primarily on with a lot of my first-time clients who are trying to decide if this is the right route for them. And there are benefits to medical pain management. There are also risks. And there's a lot to discuss, and that has a lot to do with what your priorities are.
Thank you again, Mrs. Stormbrook, for that very valuable information you shared with us. Okay, now let me take you to our third and the last poll of the webinar. So you can again see the question on your Zoom screen. So the question is, how long should a mother rest after giving birth? So you have options 1 week, 6 to 8 weeks, months, and 1 year. So what are your responses? Can you click on your responses? Let me give you a moment to click on. Okay, I can get you. Thank you for your participation. So now I'm going to share the result with you. You can see on your screen that we have 33% are saying that 1 week. Ah, that's good. That's going to be maybe. And 33% are saying that 6 to 8 weeks. Okay. And then again, 33% are saying that months. And thank you all for your participation in our third and last poll. Okay, we will now move on to our speaker's final part of our presentation about postpartum support. Mrs. Stonebrook, please.
Yes, that was an interesting poll for sure on how long you should rest after birth. We have a saying in the birth community. As I pull up the final slide, I'll tell you the saying. The saying we have in the birth community is 5 days in the bed, 5 days on the bed, and 5 days around the bed. So that's almost 3 weeks of resting and healing after childbirth. Okay, so the third piece is the third presentation in this presentation series or deck today is on doula support modalities, and that includes physical, emotional support, but also looking at what postpartum, or I should say what physical support looks like, emotional support, postpartum support, and advocacy looks like. Because much of what we do is about physical support and emotional support, but also we support human rights. And so that's an important component of what works through the threads of a lot of what we do. So just to kind of touch a little bit on a couple modalities here, physical support is important because it helps the birthing person maintain control, comfort, and safety. They feel safe when they have somebody there, a doula who might be helping them with touch, comfort, or counter pressure, helping to create a calm environment, assisting with water therapy. That might be a shower tub or cold washcloth or a heating pad, or a water birth in a tub, applying or assisting the birthing person in walking and movement, and how often to use the bathroom, and how often to eat and drink. Those are all forms of physical support. Some other things that we do for physical support may start off, a little earlier in prenatally, as well as in labor. And so we speak a lot about the physicality of working your body. So that means, incorporating some kind of a activity and movement during pregnancy. So that way during labor, it won't be so unfamiliar to you to, do stretches or do lunges or walk, right? We want to practice that early. It's good for the body. It's good for the baby. It decreases the need for medical interventions, decreases pain, increases comfort. All of these things are really important. Millions of people choose to give birth in the bed, on their backs, typically with their knees and legs up. I mean, this is a very standard way of delivering babies in the hospitals in particulars. It really benefits your doctor, this particular position, because it maximizes their exposure to your pelvis. And it really favors their perspective. But it doesn't really help you, and it doesn't really help your baby descend as well as we want it to. Although it's convenient for doctors, when folks are medicated, very few would choose to deliver on their back because it would be too uncomfortable. And that's why when we talk about the anesthesia rate being 71% in the United States, all of those people have to be on their back in a bed. So movement is really important. It's an instinctive way of coping, and remaining upright facilitates labor progress, and aided by gravity, the baby can come and descend into the birth canal. So this is really important. And there are some studies that suggest that on the back pushing can narrow your pelvis more and cause more challenges to baby coming out. So gravity is your friend. And a couple of the exercises, physical support exercises we do in pregnancy, look at sifting, which is this picture here where someone has a rebozo scarf and she's leaning over a birth ball. And so this helps with balance. This helps to get your pelvis aligned and helps with baby's position balanced. There are other kinds of positions, forward leading inversions. We're going to see one in a second, and some other things that we do to help with ligament stretching and, baby positioning during pregnancy and labor. So these positions we do prenatally, we also do in labor as well. Why do we move? Why do we prepare to, be able to stretch our ligaments and move and use gravity? Because not all labors are the same. We have a lot of times you'll have the unexpected in labor. So variations of labor. There's pre-labor, which can go on for days. There is Braxton Hicks, which many people start feeling in their third trimester. There's what we call precipitous labor, which is a very fast labor. That means everything's happening under 6 hours. We have what's called prodromal labor, which feels like real active labor. And it will go on for hours and then stop like it never happened. And then we have back labor, which can be very painful, tends to suggest the baby is OP or sunny side up. So baby's head is pushing against your back, and that can be very difficult during labor. And then prolonged labor. Some women have very long labors. So movement and physical support and suggestions for those physical supports like counter pressure and different positions can really help, facilitate a smoother labor in that way. Some of those positional changes look like this. So whether with your partner or your doula or all three, there are a number of different positional changes that can help facilitate baby getting into the pelvis better, you having less discomfort, and also kind of the movement of labor progress. During labor, a couple of things we may do to help change baby's position, or we don't turn baby or do any of that kind of stuff, but we might put you into positions that helps release, do some myofascial release, to help baby have more room. It's very safe and effective hands-on technique that involves applying kind of gentle, sustained pressure to the connective tissues that helps kind of eliminate pain and kind of restores your motion. So those tissues surround and support all your muscles in your body. So the inversion position you see here on the left helps to pull baby out of the pelvis a little bit in order for baby to rotate better. So when you sit up, baby comes back into the pelvis, hopefully in a better position. It also takes all that pressure off your back too. The other piece is emotional support. Natural pain management seems to be something that many people seek. And one of the ways we can help manage pain during labor without using drugs is a couple different kinds of theories. One is the gate control theory, which we look at things like laboring in a warm tub of water, having someone massage you. We're activating these nerves on the other parts of your body other than where your contractions are. We're activating these nerves in a non-painful way at the same time that you're experiencing contraction pain. So that way it will sort of kind of block the signals from reaching your brain and take the edge off of some of the pain you're feeling in your uterus. Sometimes we use a TENS unit. Other ideas for theories is the central nervous system control theory. So sometimes if we do things to help you feel distracted, get your mind off things, controlling your mind and what you're thinking, we can sometimes help you control the unpleasantness of the way that you're visualizing and feeling pain. Those examples look like prenatal education, knowing what to expect, hypnotherapy or hypnobabies, which I'm sure you've heard of, continuous support from a doula, aromatherapy, music, relaxation, and deep breathing. Those are all good ways of kind of keeping good mind, your mind occupied with other things. Of course, the other thing we love to do for physical support is counter pressure touch. This seems to be something that is very beneficial prenatally, but also during labor. A lot is happening to our bodies during labor, And so, double hip squeezes, counter pressures, acupressure, all of that goes a long way to help relieve, the some of the just, extra discomfort in labor. Emotional support, another huge piece of what we do and what benefits laboring people. Emotional support helps the birthing person feel cared for and feel a sense of pride and empowerment after birth. Some of the things we do to provide emotional support is our continued presence, reassurance, encouragement, praise, helping the birthing person, feel more positive about the experience, and mirroring and modeling. One of the things I do when I'm with a couple in the room and we're laboring together is, modeling really calm behavior, and normalizing that experience while I'm also, modeling and mirroring that behavior for the staff in the room. So we all have kind of set the tone for why we're here and treating those people, the people that we're serving, as individuals. And so a lot of that goes a long way with emotional support. And in some cases, we have to do some prenatal work on emotional support. So that looks like really working through, the process of what are the things that are holding you back from, being able to think about, pain management or interventions or childbirth or taking care of a baby or postpartum support or postpartum recovery. And so walking through that with your doula is a good use of how that can improve your experience and outcome. In addition, aromatherapy can always be a fun add if your doula is experienced with aromatherapy. Sometimes we hit emotional plateaus during labor and we have to work through those. And sometimes we're just nauseous. And both, there's many different kinds of scents and things like that that can help, with the nausea, discomfort, or help even with a mental mind shift during an emotional plateau. Especially if you're so tense inside, sometimes this can be helpful. We have another piece, element to doula support that is also really important, and that's advocacy. Advocacy is a pillar of support that is considered, controversial sometimes in my communities. It can suggest that because sometimes doulas are arguing whether we are supposed to be advocates or not. I think the maternal mortality rate has kind of changed that conversation in the last few years. Clearly, advocacy is not speaking for somebody, but it's actually helping to support somebody speak for themselves. So supporting an individual or group to gain what they need, and their right for self-determination. So it can take many forms. And some of those forms is like encouraging the birthing person and their partner to ask questions and verbalize their preferences, asking the birthing person what they want, stepping in moments only in times of disrespect and dehumanization, amplifying her voice if she's being dismissed, ignored, or not heard, really speaking to make sure that they are heard. Things like, excuse me, she's trying to explain something or tell you something. I wasn't sure if you heard her or not, is one example of ways that I might, use advocacy. Definitely, using positive communication techniques, and making sure that, people are aware of their pregnant rights. And so many pregnant clients are not fully aware of their right to informed consent, which is different than consent, or the OB's legal obligation to obtain their patient's informed consent before treatment. And so ACOG, acknowledges this as the physician's legal obligation to obtain his or her pregnant patient's informed consent back as far as 1974. And it's important to distinct what those are. What's the difference between informed consent and consent? Well, consent is, I'm going to go ahead and break your waters. Is that okay? You say yes or no. Informed consent is, I'm going to go ahead and break your waters. I'd like to. Here are the pros and cons. What do you think? Right? So the provider is supposed to tell you all the options and also explains benefits and risks, including the option of doing nothing. You have a chance to ask questions. You'll receive answers to your satisfaction, not theirs. You have time to think and discuss. You share your decision with your care team. That decision is honored and respected. So it's hard to remember all of this when you're having contractions and you're trying to cope and you're navigating lots of, different staff and your partner and well-meaning family members that are calling. So a doula can help to facilitate advocacy in this way by always trying to keep conversations positive and collaborative. We're always going to assume the best possible outcome, and we'll ensure you of that. And we also work to advocate as a patient advocate to help mediate when and if needed. Some examples of things that you can do, especially if you're considering or if you're needing to think about those questions for advocacy and informed consent. As a patient, you can always ask about all your possible options. You can ask them to break it down. As a partner, you can always create space in those conversations by saying, can we have a minute to think about it? Or are there any alternative options? You can advocate on behalf of your partner. And after you have your baby and your baby's in your arms, a lot of the work that we do as doulas, birth doulas and postpartum doulas sometimes work together to create a postpartum plan. But primarily as a birth doula and also as a postpartum doula, we look at providing families with culturally appropriate emotional support to assist the transitions of the postpartum period and having a new baby. We respect the parenting style of the family. We provide opportunities for the mother to ask questions. We might provide physical support and specific to the family's needs. We really focus on normal postpartum recovery, unbiased evidence-based information on best practices, and maybe even facilitate and advocate for our clients to have their needs met more. So more resources, more support. We might talk to family members and partners on ways that they can do that. And then also the other thing is we provide non-judgmental support, but sometimes we comprehend that we have limitations in that work. And that comes up, we will provide appropriate referrals to other individuals or providers, especially when there is a need for mental health resources or a specialist. The idea of that postpartum disorders can be kind of stigmatized. A lot of people don't want to talk about those. But as a doula, one of the things we do is we discuss those prenatally with all of our clients. And we discuss a plan. If you have a high risk of having postpartum depression or, post-traumatic stress or postpartum anxiety, those are really important things to recognize. And then after you have a baby, being able to talk to your provider about the symptoms you're having, and a doula can help facilitate that. You can, especially I've had past clients who I've talked to who say, Rachel, I can't sleep and I don't know why. And postpartum insomnia is a real thing, and sometimes can exacerbate into things like postpartum depression, and then also postpartum anxiety. That's also another thing. It's not just the severe forms of postpartum disorders that we see most publicized. Sometimes it goes under the radar, and moms and families just think they're tired and that maybe there's something wrong with them and they shouldn't feel that way. When really some of it is very normal to feel, down. And it's great to get a doula who knows those resources to help. So things like, what's your postpartum plan? What are the resources around you and the people that you can support you during your postpartum recovery and transition into parenthood? What does that support look like? How would you, for example, reach out to specialists if you need to? So maybe a psychologist, or maybe you need to talk to your provider about more, interventionalist methods to help you cope during that period. Or sometimes it looks like getting some assessment on hormones and also somebody to talk to. So there's a lot to look at there with what that looks like. And here are my resources for this presentation. All of these are fantastic resources. Most of what I used in this presentation today was based on evidence-based birth and DONA. Doula Match and the website for Texas Midwives are both places you can find local area midwives in Texas and also local area doulas in your area. Spinning Babies is a great site to look at prenatal movement and activity and exercises, both during pregnancy and labor. ICAN is a place to go to if you've had a cesarean and you're looking to have a vaginal birth and you're looking for support. Penny Simkin does a lot of different kinds of support and coaching strategies for doulas and couples. And then there's some information on ACOG and perinatal depression. And I want to thank you so much for listening to my presentation today. And I will put it back to Dilshad.
Okay, thank you, Mrs. Strongwood, for sharing your expertise with us, especially about the postpartum anxiety, which is really very common in this journey of some women. They are facing with this challenge. And now we are going to move towards our ending part. So with this, I'm going to move into the questions and answer portion of the webinar. So feel free to send your questions now. So there are many amazing questions are coming, and this has been just incredible. So there's a question just came up. So let me ask to our speaker now. It says that are antidepressant allowed when mothers are breastfeeding? Does this affect growth, nutrition of a child?
It's a great question. My first answer would be definitely talk to your provider about that. They would have the best, most recent information and on antidepressants for breastfeeding mothers. With that said, yes, there are actually a few antidepressants you can take both during pregnancy and during breastfeeding that are not contraindicated with breastfeeding. So that means won't affect your baby or you. But again, those are studies that, your provider would want to discuss with you. And it would be definitely based upon the individual need and medical history.
Yeah, thank you. Thank you for sharing. Okay, one more question. It's about what happens if I don't take rest after giving birth. Can you just share your thoughts about it?
I have a lot of thoughts about that. Well, number one, if you don't get rest after birth, your recovery is going to be longer. Every single time, especially in the first week or two, if you're getting up and moving around, women have a tendency to bleed more and bleed longer, especially if they're doing more work. Your uterus has to contract back. And so, giving that some time for your uterus to contract back, and all your organs that have moved and shifted over 9 months also need to come back into place. In addition, you've had a lot of blood loss. You've built double the blood volume during your pregnancy. And so after birth, give yourself time to build your blood back and get your strength back. And finally, rest is really important because it really can help you feel positive about your baby, positive about your new family, and feel like you're confident in being a new parent. A lot of women who aren't able to get rest or that rest is interrupted, it takes a little longer. It's harder.
Thank you. So it seems there are a lot of questions are coming from our attendees. So most of the questions are very relevant to each other. So I'm trying to figure out the most one which is not covered by our speaker. So one more question: how long can postpartum depression last, and is it possible to have a delayed onset?
Absolutely. To the last question. So postpartum disorders generally are on a spectrum. You can have everything from postpartum headaches and anxiety and insomnia to, the other end of the spectrum, which is, more serious, panic disorders and distorted perceptions and things like that. So there's a spectrum of things you can experience. And they found that a lot of folks who have postpartum disorders after pregnancy, beyond the baby blues, beyond those early feelings, had a lot to do with hormonal imbalance or past history of trauma or sexual abuse, things like that. But sometimes there's no answer for it. And sometimes it's just, it's a lot. You're taking on a lot of responsibility in conjunction with the huge drop in hormones that comes on right after you give birth. So as you leading up to labor, your hormones increase. And after delivery, you have a deep drop in estrogen. And so that can sometimes cause and exacerbate things. In addition to that, women who breastfeed can sometimes have latent postpartum issues and depression come on at that point. In fact, many struggle silently. I have a lot of clients who will call me a year later and talk to me about their feelings and how they can't shake this feeling of exhaustion or feeling like they aren't good enough. So we talk through that and try to get them support and help. But it can go on for years. Absolutely.
Okay, great. I think it's made the understanding clear about the question. So one interesting question that I really want to know about that also. So it's about, uh, are doula covered by insurance?
That's a great question. We get that a lot. So in Texas, as far as I know, no, we are not covered by insurance. In other states, there are some insurance companies that do offer childbirth or doula coverage or birth assistant or birth coaching. However, with that said, we are covered through the HS spending account. I can't think of the acronym for it, but a lot of times you can get reimbursement through if you have a insurance spending account or an employee spending account for healthcare. We supply you with an itemized list of all the things that we do. So that includes lactation, childbirth education, and birth preparation and labor attendance. And then you submit that and then they reimburse up to a certain amount. And I've seen that work successfully with a number of my clients. So the HSA accounts work really well.
Okay, great. Thank you for letting us know about that. So, okay, I have another question is about, should I get a midwife if I have a doula?
Yes, it's a great question. So midwives are just as different in many ways individually as obstetricians are. You're going to meet, one person who may come to your labor and want to get there early and support you and do physical comfort techniques, which isn't often with midwives, but they might. And but most of them don't. Most of them come towards the end of your labor and they're there for medical reasons. They're a medical provider. So they're just like an obstetrician. They can do everything an obstetrician can do other than surgery. So they're there looking at your baby's well-being and your well-being from a medical perspective. Doulas are there for all the other forms of support. We work really great with midwives and there is sometimes some overlap. Midwives are also looking at where the baby is during labor. And if there's positional work we can do, we work a lot with midwives who might suggest things we should do with our clients during labor. And we work really well. So we love that. Yeah.
Okay, thank you. It makes clear for me that I was merging midwives with the doula. So now I'm clear about that. And I hope everyone's clear on that.
Yeah.
Okay, I have a last question from my attendee that is saying many mothers are unclear about how much a doula can educate on their behalf. Strategies to engage the care provider.
Ooh, that's a big, good question. That's a great question. It's a strong question. Yeah, we don't speak on your behalf. It would not behoove us as doulas to create conflict for you in the birth space. This is a space that we want to protect. So we come from it from a perspective of if you, from two perspectives. One is if we see you're not being treated well, I mean, this is the extreme. If you're not being treated with respect, you're not being treated with dignity, people aren't listening to you, we will intervene and ask people to, to listen to you. We do it in a way that's, positive. And I don't think you heard, Michelle, she was trying to explain something. Could you re-explain things? We might intervene where if a provider comes in and says, I really want to break your water. I think this is what we need to do. And I can see my client is kind of stunned and not sure what to say, one of the things I might do as an advocate in that role would be to say, Michelle, do you need a few minutes to think about this? And tell the provider, or, say to the provider, does she have time to consider her options? And that's an important moment, right? Because I'm putting in, a kind of a placeholder there, give the couple time to make a decision together about what they want to do without feeling rushed. So in those two examples, both in terms of not being treated well or listened to, or also getting time to make decision making, that's mainly how we advocate. We want to protect that space for you. So we're going to find ways to advocate that continues to maintain the positive experience that you're having, and create a good energy.
Okay, thank you so much. Thank you for sharing your thoughts and your expertise with our attendees. Again, I want to thank all of you who registered and participated in our webinar session. We have learned many new things from our guest speakers' presentations. As we mentioned earlier, that for recording session and updates about upcoming webinars, please visit our social media platforms by liking and following our social feeds. We will share different valuable links on our social media platform that you can take advantage of it in the near future. I also want to thank to our RF panelists, our guest speaker, Mrs. Stonebrook, for sharing her expertise and all the amazing work that she is doing to help support families and individuals who are interested in doula support and advocacy. This has been an amazing, and thank you so much, Mrs. Stonebrook.
You're welcome. It was a pleasure to be here. Thank you.
And then I want to mention that RFUSA is producing bi-monthly series of webinar on different emerging themes. Do you find it challenging to budget, save money, or avoid debt? If so, check out our next webinar all about financial literacy on May 26th. So we are sending out invitation to everybody who registered. Please be sure to tell your friends and family to sign up for our next webinar to receive some very valuable information on financial literacy with guest speaker, Mr. Paul Pasoli. I would like to close by thanking you all for tuning in, and to remember to sign up for our next webinar because there are only a limited number of spots available. Have a wonderful afternoon. Thank you so much. Thank you, Mr. Speaker, also. Mrs. Speaker.
Thank you.
Goodbye.
Thank you. Bye.